So today we'll be talking about a very important drug that is LASIX or furosemide. We know that this belongs in diuretic group and it is a high selling diuretic, high efficacy diuretic. It means that the potency of this medicine to cause diuresis is excellent. It can cause so much of diuresis. It can also produce up to 10 liters of urine per day. It actually acts at loop of Henle structure of the nephron, and it also acts on the distal tubule as well. The diuresis, how much of urine is produced, is totally depends on the dose of Lasix that we are giving. So if we are giving 10 milligram Lasix, if it is causing suppose 50 ml or 60 ml per hour urine output, if we give 20, 30, 40, then the amount of urine produced will be getting higher and higher and higher. So that is the reason why they are called as high efficacy diuresis, and the urine output produced totally depends on the dose of the diuresis. That is the reason why 10 milligram, 20 milligram is more than sufficient. When given intravenously, the effect starts within 2 to 5 minutes. When given orally, the effect takes around 10 to 20 minutes. This LASIX or furosemide also increase the excretion of bicarbonate as well. That is the reason when they call mild alkalosis when seen on APG. These things we need to know when the patient is on Lasix, furosemide for 2 days, 3 days, 4 days, 5 days, back to back for several days, and when we need to see or look for the ABG compensation. Now, when the intravenous laxative is given, before getting this natriuresis effect or diuresis effect, it usually increases the systemic venous capacitance. It means it reduces the fluid from the IV and it more of a shifts to the venous side. That is the reason why the left ventricular filling pressures are reduced, and that is the most important reason why there is quick relief in LVF and pulmonary edema. That is the reason why maximum patients getting admitted with shortness of breath, pulmonary edema, LVF, they get relieved much faster within an hour or two because of the injection LASIX furosemide, and this effects seems to be mediated through prostaglandin vasodilation of veins. That is the reason why systemic venous capacitance is increased. Furosemide very commonly increase the uric acid in the blood. In short, it causes hyperuricemia that can also create the gout or other uric acid related symptoms. And very commonly, we need to understand if the patient is on furosemide for several years, and if the patient has persistent hyperuricemia, changing or omitting the Lasix can significantly improve the hyperuricemia. Lasix can also cause, or furosemide can also cause hyperglycemia, and it increases the excretion of calcium and magnesium in the urine. That is the reason why in hypercalcemia of malignancy, this furosemide is used along with the hydration to reduce the levels of calcium in the blood. The half-life of the furosemide is around 1 to 2 hours, so overall it acts for around 6 hours. That is the reason why it is called La6, because it acts for 6 hours. You can remember this very short mnemonic. The dose which is usually required depends on how effectively we get urine output, but it can be from 20 to 80 milligrams. In patients with CKD, it can be 100, 120, 140 milligram as well. But most of the time, 10 milligram 3 times a day or 20 milligram 3 times a day is more than sufficient. And we can increase the dose of this Lasix depending on the urine output that patient is getting. And as it increases the frequency of urination, we usually avoid giving Lasix during night time. Otherwise, the elderly patient or the patient has to wake up again and again during night time just for peeing. So you can keep these doses in suppose at morning, afternoon, and evening at around 4 to 5 to 6 p.m. so that they have this diuresis and increase urine output up to 10 to 11 p.m. But they won't get that after that. The uses of this is definitely fluid load. Many female patients, male patients, they have so much of bad habit of drinking excess of water. So many patients they drink 3 liters, 4 liter, 5 liter, even if they have hypertension, LVF. That is the reason why there is excess amount of water which is accumulated. As hypertension, LVF, they have marked tendency of retaining salt and water. That is the reason why LASIX, furosemide, they are excellent drug when we need to reduce the fluid overload. Congestive heart failure or LVF, this is one of the most common indication. LVF, congestive heart failure, can be very easily diagnosed by hypoxemia, tachypnea, tachycardia, uh, pulmonary edema, pedal edema, ascites, and crept in the lungs. And it can be treated with furosemide. Pulmonary edema, definitely, we get typically perihilar patches or perihilar involvement of lung on the X-ray. Patients may have pink frothy sputum, which is very classical and typical and very selective of pulmonary edema. Patient may be significantly tachypnic and patient may have extensive crepes. And along with that, patient may have bilateral pedal edema and history of hypertension or diabetes or earlier cardiac events. And these patients can also be treated with LASIX very, very effectively. CLD patients, chronic liver disease patients present with ascites, they very typically have ascites with pedal edema. Now, pedal edema is seen in these patients mostly only if there is hypoalbuminemia. So, in these patients also, they respond excellently to the furosemide. Then the next indication is SIDH, that is syndrome of inappropriate ADH secretion. Very commonly post-operatively, that can be any surgery like cholecystectomy, appendectomy, hernia repair. Very commonly because of the pain, because of the pain, because of the stress, there is syndrome of there is excessive secretion of ADH. That is the reason why the urine output of such patient suddenly it drops. Suppose if the patient is getting around 100 ml per hour urine output, and if it suddenly goes to 10 to 20 ml per hour, or if the urine output completely stops, then the immediate diagnosis is SIDH and it can be treated very easily even with 5 milligram of LASIX. The patient can again restart or resume the urine output journey. Suppose that the patient was getting around 70 ml, 80 ml of output per hour and the output was completely stopped post operatively because of the pain. Even 5 milligram of LASIX can again cause the urine output to resume at 50 to 70 or 80, whatever the urine output was there earlier. Now, it is one of the very important antihypertensive. In fact, before labeling a patient with refractory hypertension, the patient has to be put on diuretic because diuretics or this furosemide is highly effective medicine, especially in those patients who are fluid overloaded or those patients who are taking so much of salt and water. And this furosemide can very rapidly control the blood pressure. So it will cause blood pressure control as well as control of the pedal edema and fluid overload component. Edema, any edema that can be because of hypertension, congestive heart failure, even with nephrotic syndrome, fluid overload, this can be very, very easily controlled with furosemide. And the dose can be 10 milligram 3 times a day, or 20 milligram 3 times a day, or 20 milligrams in the morning, 20 milligrams in the evening. Usually, initially, 40 milligram, 50, 40 milligram, 60 milligram. This type of dosage may not be required if the patient doesn't respond very well to 10 milligram, 20 milligrams, then definitely dose can be increased to 40 milligram in a day or two after starting the initial dose. Immediately after myocardial infarction, so many patients present with tachypnea, with increased RR, with shortness of breath, with hypoxemia. That time, to reduce the cardiac workload, to get immediate symptomatic relief, we can start furosemide, and this furosemide can be given. As I told, it causes excretion of calcium in the urine. That is the reason why whenever there is hypercalcemia of malignancy, this furosemide can be used with IV fluids to cause uh, excessive excretion of calcium and to reduce the hypercalcemia of malignancy. When we compare with this drug with torsemide, that is DYTOR, torsemide is 3 times more potent than LASIX. The bioavailability of torsemide is 80 to 100%, whereas that of LASIX it is around 60%. The half-life of torsemide is around 3 to 4 hours, whereas the half-life of LASIX or furosemide is around 1 to 2 hours. So, for torsemide, the duration of action is around 8 to 10 hours, and it is much more potent than LASIX. So, if we are giving 40 milligram of LASIX, the equivalent dose will be around 20 milligram of torsemide. And the oral to IV conversion ratio is 2:1. So if you are giving 40 milligram of LASIX orally, you can simply give 20 milligram of IV LASIX. Or if the patient is on suppose 20 milligram of IV LASIX, then while shifting to oral, we can simply make it 40 milligram of oral LASIX. Whereas it is 1:1 for torsemide or DYTOR. So if you are giving 10 milligram of LASIX IV, we can give 10 milligram of oral uh, torsemide. Duration of action is for around 6 hours for LASIX, whereas it is 8 to 12 hours for DYTOR or torsemide. And we know that oral bioavailability for furosemide is around 60%, and whereas it is 80 to 100%, means almost completely absorbed orally. So that the problem is hyponatremia. The most common side effect of this diuretics is hyponatremia. They are diuretics, so mainly they cause loss of sodium and water. So the normal sodium level is around 135 to 155 milliequivalent, and less than 120 is what we call it as severe hyponatremia. Patient may present with drowsiness, cerebral edema, convulsion, and this can be life-threatening as well. So this risk of hyponatremia is much more significant with DYTOR compared to LASIX, torsemide than LASIX. That is the reason why preferably furosemide is very commonly used. As this causes so much of water loss, hypotension is the second most common cause, second most common, in fact not second most, the first common problem with the furosemide or torsemide is hypotension, and after that it is hyponatremia. Very commonly it causes hyperuricemia. So those patients who are put on furosemide, after few months, after few years, we have to completely keep on checking the uric acid. If uric acids are high and if furosemide is not indicated, then these drugs can be omitted or reduced in the dosage. Hypocalcemia, hypomagnesemia can be caused, and hyperglycemia, but these are usually not that much significant, and this can be actually very commonly cause alkalosis, mild alkalosis, but usually this doesn't need any treatment. So that's our for LASIX and torsemide.